The heart program at Children's Hospital of Orange County is composed of both cardiac surgery and cardiology. About 300 procedures are done annually at CHOC. Dr. Richard Gates tells us about the program.
Congenital heart disease is really something that we don't have a handle on as to what causes it. It's of course genetic, but what genetic problems lead to the development and how to prevent that from happening, we don't know. So unfortunately, when a child is born with congenital heart disease, it's sort of a fluke of nature, and there's really not much that can be done other than to treat it and correct it. Well, there are many differences between children and adults, particularly at the youngest age. Neonates, they don't have fully developed kidneys, lungs, or hearts. So the way you treat them, and the medicines they need, and the techniques for performing heart surgery on them need to be different. We've operated on children open heart surgery at 3.5 pounds and greater at the Children's Hospital. We've also done a good deal of research and really are considered a national leader in perfusion techniques. This is an area of great interest for myself, where I've published and presented nationally. Well, the heart program at the Children's Hospital is composed of both cardiac surgery and cardiology. On the cardiac surgery side, we do around 300 procedures annually, both open heart and closed heart procedures. On the cardiology side, we have an interventional cath lab where we perform upwards of 200 interventional cases and just as many, if not a bit more, diagnostic catheterizations. There's also a full complement of echocardiographic services, including fetal echo, as well as routine post-operative echo, transesophageal echo, and standard outpatient echo. We also have an electrophysiology department, which is complete for diagnostic and interventional procedures as well. All patients that require heart surgery can be treated up to 18 at the Children's Hospital. The team approach is really critical, particularly for pediatrics. And involved in the team begins from the cardiologists and from their outpatient care right up to the time of hospitalization. From that point, we have a multidisciplinary team approach, which is championed by our director of the Heart Institute, Anthony Chang, who's a worldwide expert in multidisciplinary approach to pediatric heart surgery and heart patients in general. So members of that team would include your surgeon, your anesthesiologist, your critical care doctor, or intensivist as they're called, your cardiologist. It would also include pulmonologist and nephrologist. They all meet on a daily basis and discuss all components of the patient's care, and everybody's allowed to chip in, and we feel this is a much better way of providing care for a patient rather than just individual physicians working one-on-one. It's believed now that repairing a child's heart in the first few months of life is actually more beneficial than repairing it at age 2 or 3. That allows the normal physiology to take over and the children to do better. We're developing ways of operating on children now, even before they're actually born, or fetal heart surgery. So in the future, I think what you'll see is interventions younger, diagnostics being made when the child is yet to be born, and interventions actually being performed on children who have yet been born.